There we go. Hopefully everyone can see that. So like Tim said, my name's Betsy and I'm from Healthworks. So we're a community health charity, and we're based in the West End of Newcastle. So for 30 years, we've been working with people across the Northeast to reduce health inequalities and improve health outcomes. So that might look like delivering children and family sessions or cancer awareness sessions, like what I do. We also do things like breastfeeding support and staying steady as well. So there's a whole range of things that we do to try and encourage healthy lifestyles and general health and well-being across the Northeast. Just a quick mention before I get into my slides as well. In the chat there is a link, and it's just a really short Microsoft form. It just captures a little bit of demographic data, so that we can basically pass it on to our funders to show who we've been speaking to, if that's all right. So if you do get a chance, just to fill that out, that would be super helpful for us. Thank you. So I'll talk first a little bit about what cancer screening is. So cancer screening targets a specific population or group of people, and it acts like a filter. So most people who will go for the screenings, they'll be healthy people, they'll have no signs or symptoms, so they'll be really unlikely to have a certain condition, so they'll pass through the filter or the screening test without sort of any further ado. They'll just be told that the screen test came back negative and they'll just go about their lives until the next one comes around. But if there is anything in their results which suggests they are more likely to have a certain condition, they get caught in that filter, and they'll be sent for further testing to determine if they really do have the condition or not. So it is sort of like a safety net type of thing, rather than being a diagnostic test in itself. You'd have to have the further test afterwards to diagnose whether you actually have that specific condition or not. So screening is super duper important. So it reduces the number of people dying from cancer by detecting the cancers really early. So 63% of cancers that are detected through screening are detected at the earliest stage. So that would be stage one. And when they're caught at this stage, they are so much more treatable, so much more sort of easy to recover from as well. So being able to catch them at this early point is really, really important. And they can also reduce the number of people dying by cancer by preventing cancer from ever developing. So in terms of the bowel and cervical screenings, they can actually catch things before they even get to the point of being a stage one cancer. So for cervical screening, for example, that detects HPV and any abnormal cells. So if you are detected as having HPV, you're then monitored more closely. So you have annual screenings, and that way they can monitor if there are any cell changes happening, and they can burn those cells off before they develop into a stage one tumour. So it is so important that people are attending their screenings. So we'll talk about breast cancer first. So we're going to cover all of the cancers that are affecting women. So we talk specifically about breast, cervical, and ovarian cancers, but we'll also talk a little bit around the more general cancers, which obviously will also affect women as well. So bowel, lung, that sort of thing. So breast cancer first. So breast cancer is cancer that starts in the breast tissue. So both men and women will have breast tissue in their chest. So anyone can get breast cancer, but it does mainly affect women due to the fact that we do have more breast tissue than what men do. So breast cancer is the most common cancer in the UK. So around 56,800 people are diagnosed with breast cancer every year in the UK, and around 400 of those are men. So over 56,000 women are diagnosed in the UK with breast cancer. There are a lot of different types of breast cancer as well, so it's not just sort of one fits all type of thing. You can have so many different varieties of breast cancer, which means you'll need different treatments. There'll be different approaches, and it can also be diagnosed in different ways. So, for example, some tumors you might only be able to pick up on a mammogram. So even if you're doing self-checks, you might not be able to detect those yourself. Whereas other tumors, you might feel a lump if you were doing a self-check. So that's why it's important to both be going for screenings and for doing self-checks as well. So talking of breast screening, so the breast cancer screening program is called a mammogram, and you're eligible from the age of 50. So from 50, you're invited every 3 years for your screening. Your automatic invites do stop when you turn 70. However, after that point, you can still request a mammogram. So even though you're not on the automatic register to be receiving those invites, you can still call up and book yourself an appointment. So it's still worth doing if that's something that you are worried about or something that you would give you more peace of mind. It's worth still going. For anyone who's not had a mammogram before or isn't sure what happens when you have a mammogram, basically it's a machine like the photo shows on the slide, and essentially they will place the breast tissue onto the plate, and then the plates sort of push together and take a photograph of the inside of the breast. So it'll be a photograph from the top and the bottom first, and then from the side, and then they'll do that on either side of the chest. So it's quite a quick procedure. Some people can find it a little bit uncomfortable because of that like sort of tight pressure. But it's not anything to really be worried about. They've got all sorts of different like positions that they put you in, like they might ask you to lift your arm over your head, things like that. And it's basically just so that they can get the best image possible of your breast. So that's what is involved in a breast screening. So breast cancer isn't just a lump. So there's a lot of symptoms that it can present as. So in terms of signs and symptoms that it could be, these are the lemons that we use to represent obviously breasts. So it could be feeling a thick area of skin, a dimple, a crusty nipple, any red or hot areas on your breasts, any fluid leaking from your nipple. It could be a bump or a raised vein. It could be a nipple that becomes inverted. So if you didn't already have inverted nipples, that is. So some people are just born with inverted nipples, and that is their normal, so that's okay. But if you didn't have that already and one became inverted, that would be a sign of breast cancer. A new shape or size, orange peel skin, or a hard lump. So there's plenty of symptoms that it can possibly be. It can be quite difficult to remember all of these, but I think the main thing to remember is just if there's any change, if there's anything that's not normal for you that wasn't there before, and it's there for a couple of weeks or longer, it's always worth going to the GP to get it checked out. So when you're checking yourself, it's really important that you're doing a self-check around once a month. We do recommend around the same time each month, so it doesn't really matter what time of the month you do it, just that it's around the same time. That's only because if you have a menstrual cycle, you'll feel slightly different at different points of your cycle. So for example, when you're on your period or just before your period, you might feel a bit more tender, a bit more swollen, and that's quite normal with hormones. However, after your period, you might feel slightly differently, and it can affect how, like, when you're actually checking how your tissue sort of feels. So if you're checking at the same point of each month, you'll get familiar with what you feel like at that point in your cycle, so that it's a little bit easier to remember whether that's something that's new or something that was there before. There is a text reminder service that Copperfield deliver. So if you go on the Copperfield website, they have a number that you can text, and basically you text it once and then they'll send you a text reminder every single month at the same time of the month. So I get them on the first of the month. And it's just like a little ditto type of thing, which is just acts as a reminder to check yourself. So I think this month it was something about pancakes because it's pancake day. It was like check your pancakes, something like this. So yeah, it's just like a funny, light-hearted way of like reminding you to basically check your chest. So when you check in, you put one arm behind your head, use the pad of 3 fingers, and go in small circular motions all the way up to your collarbone and under your armpit as well. And you can use one of the 3 search patterns that's on the slides. I would recommend going in circles, just because it's easier to sort of spiral inwards and make sure that you've covered the entirety of your chest. But if there is a different search pattern, so like going down in lines or something like that, that makes you feel more comfortable, that's totally okay as long as you're checking your whole of your chest. It's also really important to be checking behind your nipple as well. So a lot of people will do a really thorough check of the rest of the breast tissue, but completely miss out behind the nipple. And that's where a lot of lumps can sort of hide and get sort of left unchecked for a while. So it's really important that you're doing a really thorough check. And obviously, when you've done that, swap to the other side. Have a look as well. So look in the mirror, see if how they sit, see where you sit on your chest wall, if one's bigger than the other, which is totally normal. I mean, they're sisters, not twins, is what we always say. So it doesn't matter if one is slightly bigger than the other, as long as that's your normal and that's not changing too much. So yeah, have a good look, have a good feel, and get familiar with your anatomy. So that's everything on breast cancer. So moving on to cervical cancer. So cervical cancer affects around 3,200 women every year. So it's most common in people over the age of 50, but you are invited for a cervical screening from the ages of 25 to 64. So that is basically the sort of prime time that they're checking for any HPV or anything like that. So your cervical screening is checking for the presence of the human papilloma virus, not to be confused with HIV, even though the acronyms do sound quite similar when you say them out loud. So basically, that is a sexually transmitted disease, and that can, if your body and your immune system doesn't clear it out itself, and you have a persistent infection of HPV, it can cause cells to become abnormal and then develop into cervical cancer, and that is the leading cause of cervical cancer. So that is why they're screening for HPV. Symptoms of cervical cancer would include bleeding during or after sex, bleeding after that you've been through the menopause, bleeding in between your periods, any change to your vaginal discharge, and any pain or discomfort during sex as well. It can also be pain in your lower back or in your pelvis too. So if you have any sort of symptoms that aren't normal for you, it's really important that you go and get them checked out. Obviously, a lot of these symptoms can be put down to a variety of things. If you have one of these, it doesn't necessarily mean you've definitely got cervical cancer. But it's worth getting it checked out because that could be down to other conditions which will still need treatment from a medical professional as well. So a little bit more on human papilloma virus. So like I say, it's a sexually transmitted disease and it lives on the skin in and around the genital area. So most HPV infections will get better on their own and don't cause any symptoms. And about 70% of people who aren't vaccinated will get HPV in their lifetime. And you probably wouldn't ever even know that you had it. It doesn't really tend to cause any symptoms. And your body can generally clear it quite well. It's just if you have an infection that's persistent, and it doesn't get better on its own, and it's one of the high risk strains of the virus, so there's a lot of different strains, that can then cause cancer, as well as it can also be a contributing factor in some head and neck cancers as well. Because of things like oral sex and things like that that would transmit it. So that's why the HPV vaccine is offered to everyone in year 8 at school. So that's been running for a good few years now. And that's sort of used to protect against the specific strains of HPV which are linked to causing cervical cancer. So you only have to have one jab now. It used to be 2 different doses, but you just have one. And if you did miss your vaccine when you're in school and you're under 25, you can get them free on the NHS, or you can pay after you're 25 to have it done. The reason why they try to do it under 25 is because the younger you are, the less likely it is that you'll have had any sort of sexual contact. So the likelihood is you won't have been exposed to HPV yet, so the vaccination will be more effective against it. So obviously the older you get, the more likely it is that you'll have had that sexual contact, may have already been exposed to HPV, so it may not be as effective for you. So moving on to ovarian cancer. Ovarian cancer is quite a rare cancer in terms of like when we're talking about like general cancer statistics. Most people who get it are over 50, and there isn't a screening for ovarian cancer at the moment. It is a cancer that gets more common as you get older. So your risk does increase as you get as you get older, which is generally the case with most cancers, to be fair, apart from testicular cancer. And it is one that tends to be diagnosed quite late. So it's quite rare for ovarian cancer to be caught in sort of stage one. And that's because the symptoms that it gives you are really sort of not distinctive to ovarian cancer. So it will be a swollen tummy or feeling bloated, feeling quite full quickly after eating, needing to wee more often, pain in your stomach. So because they're quite sort of general symptoms that can be linked to a lot of other conditions, it can sometimes take quite a while for it to be put down to ovarian cancer. So if you are having any of these symptoms quite frequently, so like 12 or more times a month, so that's like more than 3 times a week, it is really important that you visit your GP and get it checked out, because it might be something completely unrelated. It could be a UTI if you're having the urgent need to pee, and it's been quite a short term, or something like that. But it could also be something more serious. So it is really important that you're having that checked out. So moving on to bowel cancer. So bowel cancer cases are more common in people over the age of 50, and it's the fourth most common cancer in the UK. So it affects men and women. It is slightly more common in men than it is women, but it still does affect a large proportion of women, so it is still important to talk about. So in terms of bowel cancer, your signs and symptoms that you'd be looking for would be blood in your stool, any changes to your stool like habits. So if you're going to the toilet, like needing the toilet more often, or your stool itself has changed. So we would say a healthy stool would be a type 3 or type 4. And we tend to compare that to a toffee crisp or a galaxy ripple because it gives you a more sort of descriptive visual of what that would look like. Because if you say type 3 or type 4, a lot of people don't know what that means on the Bristol stool chart, which is why we compare it to chocolate bars essentially, because everyone can sort of picture what that would look like in their head. So yeah, healthy stool, type 3 or type 4. So if you change to say a type 7, which we compare to a hot chocolate, or a type 1, which we compare to a Maltesers, and that was, for a couple of weeks or longer, that is a concern because you're having consistent changes in your stool. Everyone might have something to eat that doesn't quite agree with them and change stool type for a couple of days, and that's perfectly normal, not necessarily something to worry about. It's if those changes are prolonged that you need to be sort of a bit more conscious and probably visit in the GP. Just be clear about it and honest. They're not going to be, judging you or anything like that. You just need to clearly explain what you've been going through, and they should be able to refer you on for further testing if needed. So some people do have other conditions which can cause changes in stool. So if you have IBS or Crohn's, for example, you might consistently be at a type 6 or type 7. If that's your normal, then that's okay. It's just if you were to change away from that normal. So say you were consistently a type 6 or a type 7 and you suddenly went to like a type 1 for a couple of weeks, that would be a change from your normal. So it would be really important that you go and get that checked out. So in terms of bowel screening, so it's a really simple check for the bowel screening. So it gets sent out in the post, and it looks like the little kit that's on the screen there. So it's just a little test tube type thing. And all you have to do is take a stool sample using the little kit, and then you send it back off in the post, and then they check that for any blood that's in the stool that you can't see with the naked eye. So that would be a sign of either bowel cancer or another condition which could eventually lead to bowel cancer. And they'll then be able to, refer you on for further testing and treatment if it was detected that way. So there are some tips and tricks through cancer research for, completing the kit. We would probably recommend the cling film over the toilet because it is quite an easy way of going about collecting your stool for the stool sample, because it's really important that the stool doesn't touch the toilet water. So we cling film over the toilet, leave a dip so that it doesn't bounce. We have had people say that that's happened to them before, unfortunately. So you just collect the stool, use the little kit, you just unscrew it, take the little stick. It looks a bit like a mascara wand on the end. It's got like little grooves in it. You just brush that along the poo so that it collects a little bit of stool in the grooves. You don't need to like gouge it out or anything. Put it back in the tube, write the date on it, and then send it off in the post, and they'll just do some testing on that. If you were to have symptoms of bowel cancer, so for example, you had some blood in your poo that you'd noticed, you might visit the doctors and they might send you a kit that's similar to this. However, the top of the tube will have a different colour, and that's because there's a different level of sensitivity for the symptomatic tests versus the screening tests. So they'll basically be checking for things slightly more, in depth than what a screening kit would do. Unfortunately, we do have a national target of 60% returns on the bowel screening kits. We're way below that at the moment. People aren't sending them back. So we are really trying to, advocate for completing your test kits. So you've received these when you are 50 now, I believe it is. 50 or 60. Is it 60? 60. I think it's 60. Sorry, had a bit of a brain fog moment there. You can tell it's Friday. So yeah, 60. You get them through the kit through the post, and then you send them off. So it's 60 to 75 that you have these. So yeah, it's really important that you're completing them and sending them back. It's the easiest screening test that you'll ever do. So much simpler than having to go to the doctors and that sort of thing. So yeah, really important to be completing those. Skin cancer, so anything relating to skin cancer, we tend to link with the sun, but also with tanning beds as well. So in Gateshead and Newcastle in particular, we see quite a spike in skin cancer incidents compared to the national average, and that has been linked to the number of tanning shops and things that are in the area. So it's really important that you're looking after your skin. So when the sun is really strong, obviously avoid avoid being in the direct sun, spend some time in the shade and cover up with some light layers. And apply at least SPF 30 or above. So on the side it's SPF 15, but we tend to recommend SPF 30 with a 4-star rating or higher. So on the bottle it will say obviously your SPF, which is the bigger number, and then in the little circle it'll have UVB, and then it'll have a number of stars. So you want it to be 4 or 5 stars. And then you need to make sure it's in date as well. So your sun cream, it'll have either a date printed on it if it's like the metal tin, or it'll have a little pot which is like it'll say like 12 or 24 months. So that is telling you basically how long since you've opened it that it will be effective for. So it's important that you write on your bottle when you've opened it, so that way you know you're not exceeding that expiration date and using a sun cream which is less effective for you. And obviously, as well as all of this, it's important that you're not using tanning beds and things because of the dangers of them. So with all of this, any changes to moles, they are the biggest sign of skin cancer. So if you have any like blurred edges, any bleeding from a mole, any changes in colour or shape, any that look particularly different from other moles that you have, that is when you need to be sort of going to get that checked out by the doctors, and they can either use like it's a special type of microscope. I think it's called a dermatoscope. I could be wrong. And they basically press it on your skin and it gives them a good clear view of what's happening with your mole to see if it sort of has any indicators of being a melanoma, for example. Or they might have to do a biopsy as well. But it's always worth getting it checked out. So that is everything on skin cancer. So move on to lung cancer. So the signs and symptoms of lung cancer are having a persistent cough, shortness of breath, repeated chest infections, coughing up any blood, any pain in your shoulders or chest or arms, and any unexplained weight loss. So it could be that, you're hearing these symptoms and you're thinking, well, that just sounds like a cold or flu. And it does. It can be easily mistaken for something like COVID, for example, especially with that being relatively fresh in people's memories, even though that was 6 years ago now, which is crazy to think about. But I think it's really important to note that these are symptoms, if they've persisted for 2 weeks or longer, that you need to be bringing to your GP. So we recommend making a list of your symptoms. So if you're having a persistent cough, shortness of breath, and you've had that for 2 weeks or longer, you've tried some over-the-counter medicines and they've not been effective. It's really important that you're going into your GP, explaining that, saying what you've tried, how long you've had it for, so that they can basically skip out anything like where, when you visit and they say, oh, well, why don't you go away and try this medicine? And then you have to try that out, go back and forth. Obviously, that delays any sort of treatment or testing. So it's really important that you are going and presenting with all of the evidence that you've got of what's been happening to you, and they will basically be able to take that out and skip away any of the like middle steps, basically. There is a lung screening program. Sorry, I thought I had a slide on it, but I clearly don't. There's a lung cancer screening program which is in the very early stages of sort of being rolled out at the moment, and that is for current or ex-smokers who are over the age of 50. And yeah, if you go to GP and they're aware of your smoking status, so either that you are a current smoker or that you're an ex-smoker, so you're classed as an ex-smoker if you smoked over 100 cigarettes in your lifetime, that would classify you in the like smoker bracket. They can then put you down for an automatic invite for a lung cancer screening. And they will listen to your chest, do some scans, and basically be able to pick up any signs of lung cancer, but also any other lung problems, so COPD, that sort of thing. They'll be able to pick that up too. And this has been really successful so far. So there's been a lot of lung cancer cases which have been picked up in stage 1, which is very, very rare for lung cancer before the screening program was rolled out, because obviously it takes a while for these symptoms to start causing a problem. So yeah, it's been really successful so far. So if you do get an invitation sent out for that, it's really important that you go and attend. But overall, so if you take nothing else away from what I've talked about today, if it's not normal for you, it's really, really important that you tell your doctor, visit your GP, explain to them exactly what's been going on, and make sure that you are being taken seriously. Essentially, if you feel you've not been taken seriously, you can always ask for a second opinion. And there is a new law that's come in within the NHS, where if you present to the GP 3 times with the same symptoms, and they're not improving with treatment, or they're not going away, they're sort of an unexplained cause, they have to reassess your case and look through and do a bit more further investigation. So if you do have anything that's really concerning you, and you feel like it's something that needs a bit more further investigation, it is really important to be persistent. I know how difficult it can be to get a doctor's appointment, and a lot of people struggle with that. However, it is worth persevering. There's always the e-consult and the NHS app that can sort of come in handy with booking GP appointments. And at the end of the day, it's what your GP is there for. If there is something that's on your mind and that's worrying you, it's really important that you go and visit them, and basically explain that it's, causing you some concern. And if it doesn't turn out to be anything, fantastic, it's a weight off your mind. If it does turn out to be something, you've picked it up at an earlier stage, so it's more treatable, and more likely to, lead to a more successful recovery. So it's really important that you're visiting your GP as soon as possible, essentially. So these are our email addresses for Healthworks. So we deliver this sort of information across Northumberland, as well as the rest of the Northeast. So if you are interested in having a bit more of an in-depth talk, we do cover men's cancers as well as women's. You can always give us an email, and we come out to local businesses, community centres, groups, anything like that. We can either do a stall or a talk like this, and basically just run you through signs and symptoms of cancer. We do a little bit on the Eat Well guide as well, so a healthy diet and lifestyle factors that can contribute to your cancer risk. And yeah, we can run through things more in depth and tailor it to basically whatever you'd like. But thank you very much for listening. I'll pass over to Tim now, who's going to be in charge of fielding any questions. But I hope you've all learned something new and that you've enjoyed listening to my talk. Thank you.
Thank you very much for that, Betsy. I'm not sure enjoy is the right word, but I certainly found it grimly fascinating. So, on one other point, is you mentioned that we weren't sure when people, what age they were for getting a bowel cancer screening test sent out to them. Some people put in the chat it's from age of 50, and you get sent a test every 2 years. So,
Yes, it is. Yeah,
um,
every 2 years. Yeah, it was had a little moment there where I was
yes,
like, is it 50 or
up,
60? Yeah,
up until sort of there.
yeah.
Yes,
But
great. So, have we got any questions? Let's have a look and see the chat. Um, I've got a question actually. Go back to breast cancer, your first cancer you talked about. Um, Admittedly, it's less than 1% of all cancers, breast cancers are male. But just for a matter of interest, because there are a couple of males on the group today, are the symptoms the same for men and women for breast cancer?
yeah, so it's a really good question actually. It's not really talked about very much for um breast cancer in men, but it is essentially the same symptoms that you'd be looking out for. So it would be any sort of lumps or bumps, any sort of changes if you had a rash or any changes to, your nipple if you had any crust or anything like that. The symptoms you'd be looking for would be very similar. And the way you would go about checking would be the same. So you would do the same sort of self-examination. Obviously, men aren't eligible for the mammograms. So it is still, it's one of those where it would be if you sort of detected it yourself that you'd be able to
Mm.
have that sort of investigated. But yeah, there's still ways and means that they go about doing the scans. It wouldn't necessarily be the same as like a mammogram would be, but they might do like an ultrasound, CT scan, that sort of thing to sort of get a picture of what's going on. So yeah.
Okay, thank you. We've got a couple of questions. First one, is a question about younger people getting bowel cancer. Do you know do you know the statistics for younger people?
So off the top of my head, I couldn't tell you what percentages of younger people are getting bowel cancer. We do know that it is more common in people over the age of 50, and it is about it. Bowel cancer is a type of cancer which gets more common as you get older. So I'm not sure off the top of my head exactly the statistics with younger people. Obviously, if a younger person was still experiencing the same symptoms, it would still be really important that they go and get that checked out and they use the kit that's sent out by the GP. But yeah, it's one that is more common as you get older. A lot of that is due to lifestyle factors as well. So, diet and things like that is something that can make a big impact with bowel cancer. So the longer, obviously, you're exposed to certain things as well, the more the higher your risk will be, which is why it tends to be in more older people as well.
Okay, yeah. And then there's another question. Where is the area of coverage for the campaign? Is it limited only to the UK? It's obviously, I think this is from someone from abroad who's asked this question.
Right, okay. So the screening programs and things that I've talked about today are in the UK specifically. In different countries they might sort of vary. They do have cancer screening programs in various other countries. Like I know in America they still do the cervical screening and the mammogram similar to what we do over here, just within their own sort of systems. But yeah, I couldn't answer specifically for other countries exactly what their programs are. But they'll all be backed by similar sort of research to what we have in the UK. It'll just be dependent on government funding in each
All right.
individual country.
Yeah.
Um, but if you did want to learn more, there is always like um lots of resources online. Your country will probably have sort of a government like scheme around what they do around cancer and cancer screening, that sort of thing. So
Yeah. Thank you. Have we got any other questions for anyone? Give it a couple of minutes. Oh, so that person said thank you very much for that question about overseas. That's okay. Um, I had another question as well, but it's gone out of my mind now.
it's okay.
I'll just wait a couple of seconds for another question. Um, So we don't actually give a certificate for this. This is purely informal learning, but it's public service. So sorry, can't help you with a certificate there. Okay, well, it looks like, here's a question. There's been a lot of press recently about changes to cervical screening. Do you know when this is changing?
Yeah, that's a really good question, actually. So, cervical screening recently has swapped over from every 3 years to every 5 years. So, that is if you don't have any HPV detected. So you'll have instead of going for 3 yearly checkups until you're 40 and then swapping over to 5 yearly checkups, it just stays as 5 yearly the whole way through. And that is because of the success of the HPV vaccine and also because of the nature of HPV. So if you're infected with HPV, the likelihood is of it developing into any sort of cell change or anything is really unlikely in between those sort of 5 years. So it's very, very slow developing. So if even if you were infected with HPV the day after your cervical screening, 5 years down the line, the likelihood is that that won't have developed into sort of anything cancerous. So they'll still be able to pick it up at your next cervical screening. So that came into play last April. So that's swapped over now. It's still the case though that if you are HPV positive, they'll check you every year for the next few years, so that it will basically be able to be monitored to make sure there's no cell changes happening. And then they are also talking about a few other methods of cervical screening. So cervical screening uptake is relatively low in certain areas, and a lot of that is due to fear, and it's also quite an invasive procedure in terms of obviously
Yeah.
that you have to insert a speculum. It can be quite uncomfortable. It can be quite scary for some women as well. So they are talking about using menstrual blood. So you would collect a sample of menstrual blood, and they would use that to check for HPV. And they've also talked around self-test kits as well. So it would be a swab similar to like an STD testing kit. So that would just be done at home and sent off. But that hasn't been confirmed as to when that would be happening or exactly what that would look like yet. I think they are looking for it in the near future. However, it is, it is something that's being discussed, and I think it would be a really good thing because it would take a lot of the fear out of cervical screening, especially because cervical screening is so important and can potentially prevent cancer developing completely. So yeah, they're still working out sort of the details. And we don't have an exact date of when that's going to be, but yeah, hope that answers your question.
Thank you. Thank you for that. So another question of what happens during the menopause? Does screening continue or does it stop?
So your
Oh,
cervical screening, I'm assuming we're talking about cervical screening for menopause.
yes.
So that will continue until you're 64. So it's
Mhm.
between 25 to 64. So they do still screen you after menopause, up until then. Um, Basically after you turn 64, the risk and the cost benefit of the cervical screening, they've determined that that sort of tips the other way, so they stop screening after you turn 64.
Okay.
But yeah, they will still check, and so that's also one of the main symptoms. So if you've been through the menopause and you suddenly start bleeding after you've been through the menopause, that's another key symptom of cervical cancer that you need to be aware of too.
Okay. And from our own feedback from the public, we've recently heard that people living in our most deprived communities are less likely to attend diabetes screening. Is this also the case with cancer screening?
Yes, so it is absolutely the case. So that's part of what our work is. We work with deprived communities to try and encourage them into cancer screening programs. So essentially there's a lot more barriers than someone who is living in a more affluent community.
Mm.
So things like transportation into cancer screenings, childcare, cost of transport into screening programs as well. All of these things can be huge barriers, and appointments around work. if you work shifts as well. So that is a lot of the reason why we see a lot less people from those deprived communities heading into cancer screening. So we do a lot of work around that as well. So we go out with the mobile screening units and try and encourage people to drop in to their cervical screenings on the units. They also do mobile screening units for mammograms as well. So we go to where they are essentially. And they've got, it's just on a bus. If they've got the kids there, I mean, they've got wonderful staff there that work and bringing people in so they can, keep an eye on the kids for 5 minutes while you get your cervical screening done. So there's a lot of amazing work that the community teams are out there doing to try and encourage people from those deprived communities into their cancer screening programs as well.
Yeah, I've seen the big container lorries, trailers out in the car park near us at work.
Yeah, they
So,
go to little car park, everything.
yeah, quite amazing. What can they fit? What they fit in a bus or a trailer now?
Yeah, exactly. It's wonderful. I think it's such a good program as well.
Another question here. If you've had any parents who have had cancer, should this be something you should mention to GPs when you have a checkup?
Yeah, I think that's a good point. So there is a genetic factor to cancer. Not as much as some people think though. So it's only like a very slim percentage of cancers which have a direct genetic component. However, if you do have a family history of cancer, it is important to mention this to the GP, especially if the symptoms you're presenting with are something that make you concerned about cancer. So it's always worth mentioning. You can also, if you have had a parent or sister or daughter or someone who's had breast cancer, you can also get the genetic testing done for the BRCA
Right.
gene, which puts you more at risk of developing certain strains of breast cancer, prostate cancer, ovarian cancer, that sort of thing. And they do that through the Centre for Life. So basically, that's in the middle of Newcastle. You just go, you fill out a stack of paperwork. It is about this thick, to be fair, and just asks you about, your family history and that sort of thing. And then they do a little bit of testing, and they can determine whether you've got the BRCA gene, and basically whether that puts you at more significant risk for those types of cancers. So yeah, it is worthwhile mentioning if you go to the GP and you have those symptoms that do concern you. I think it is worthwhile mentioning.
And did you say that you can get access to that form through the GP? Is that how?
Yeah, so if you mention it to the GP, they can sort of refer you on, but I think you can also do it directly through the Centre for Life. So they
Right.
have like
Yeah.
a research trial as well that you can do, and they have more information on their website as well. But it is worthwhile doing. They also sometimes do that genetic testing when you've been diagnosed with breast cancer. So my mum had breast cancer, and she had the genetic testing done when she was going through treatment. And luckily she doesn't have the BRCA gene, so I'm no more at risk, luckily. But yeah, it is worthwhile looking into.
Great. There's another question here. Someone participated in the NHS Galileo trial, where a single blood sample could test for over 50 cancers. Do you know if this has been rolled out yet?
So there's no news on that being rolled out en masse at the moment. I think there's a lot of stages and experimental trials that they have to go through before they can sort of confirm and roll things out like fully. But I mean, fingers crossed. It's making lots of noises. Um, Fingers crossed that it is something that is deemed successful, and they can sort of roll it out more widely, because obviously if there is something as simple as a blood test that can check for all of those cancers, it would be amazing and hugely
Yeah, a lot less invasive in some ways.
yeah, absolutely.
And 50 cancers, which is over 50 cancers, would be amazing if they could catch that
Yeah,
many early on before it even got to stage one. Because when I first was aware of cancer, which was back in my teens, I said the statistic was 1 in 5 people um, would be affected by cancer either themselves or a family or friend. But now it's 1 in 2, so it seems to
yeah.
be more and more prevalent. So,
Yeah, I think a lot of that is also down to our awareness and our ability to diagnose it as well. So it does seem the statistics have gone up, but a lot of that is because we've got more sort of fine-tuned diagnostic tools.
Yeah.
So yeah, it's I think it can be like a multi thing.
So there's a comment here from one of the listeners. Also, if you have a family history of bowel cancer, endometrial cancer, think about genetic risks. So obviously, those two cancers are a high risk of genetic passing on.
Yeah, so it can be like there's definitely a genetic link, particularly with the endometrial cancer. That is one that can be linked to the BRCA gene as well. So that does have a genetic component. So yeah, it's definitely if you've got family history of any cancers really, it's important to sort of keep that in mind and mention that to GPs if you're having any symptoms or anything like that.
Great. Are there any more questions for anyone? Had some good discussion points actually so far. So thanks very much for that for everyone that's participated and asked a question. I mean, if you didn't want to put something in the chat, you can always contact us at Healthworks direct, info@healthworksnorthumberland.co.uk, or you could contact Betsy, and her email will be on the slide, and we'll send them around afterwards. I'm sure you don't mind answering questions.
Yeah, absolutely. I don't mind answering any questions. I'll just put the link for the demographics form just in the chat again. Just if anyone didn't catch it before, if you don't mind filling that out, that would be perfect. But yeah, thank you so
This
much.
is for your funders, isn't it? Because not everyone's aware.
Yeah, so yeah, it's just basically captures a picture of the audience that we've spoken to, and it helps us gain more funding to be able to do this again, in different places. But yeah.
Great. Well, I think that's it for questions. So we'll give you 10 minutes of your day back. Thank you very much, everyone, and see you next month. It'll be, well, it's autism and mind are talking for us next month. So see you then, hopefully. Bye.
Thank you so much.